we have Dr. Bagul to speak here to talk about it. Dr. Bagul, can you please put your camera on so that everyone can see you in the session? Dr. Bagul, can you hear me?
Yes.
Dr. Bagul, you are looking as handsome as ever.
Hello.
Dr. Bagul, Dr. Bagul comes with 31 years of experience. My friends, we are honored to have a doctor who has 31 years of clinical experience in orthopedics, doing orthopedic surgery. He is one of the best orthopedic surgeons himself. And then later on, he moved on to taking care of the stem cell therapies. Okay, Dr. Anand Bagul, he is a pioneer of the stem cell therapies in India and foreign countries. Besides taking care of avascular necrosis, he also takes care of various other conditions like cerebral palsy, autism, muscular dystrophy, lung fibrosis, and even the kidney functions. So a lot of it that Dr. Bagul does. Dr. Bagul has already treated more than 2,000 patients with the stem cell therapy and has a success rate. Wow, has a success rate of 72%. That's the greatness of Dr. Bagul. We have him over here. It's a pleasure to have him over here. Dr. Bagul.
Hello. Hi. I'm with you. Yeah, it's really nice to talk with you, all group of people. We can just start talking, not a shout out. Okay.
Great. We can start talking. So just to keep this, Dr. Bagul, to keep this thing interesting, energetic, I think let's start with the question and answers. Instead of, doing the presentation, people are already have joined it like at 3:30. They might be sleepy as well. You never know. So let's have a question.
So you can start with the interaction, question and answer.
Yes. We will start with the interaction. So first thing first, Dr. Bagul, what is AVN? Like, how would you put it in simple words? What is AVN? What is avascular necrosis? In simple terms.
Yeah, avascular necrosis itself indicates that a vascularity of some part of the bone, a head of the femur, is affected. The head is not getting adequate blood supply and it dies off slowly, steadily, and will lead to the deformation and flattening and further changes in the hip joint, which is leading to the hip joint arthritis.
Okay. Wow. So the conventional therapy on this, according to our knowledge, was the hip replacement. Am I right, Dr. Bagul?
Yeah, right.
Okay. So what is the treatment protocol that you are going to introduce today?
Yeah. In the era of the COVID, all the scenario has definitely changed to a great extent. That younger and younger patients have started getting the avascular necrosis of the hip joint. The problem is that usually for the avascular necrosis, the total hip replacement is answer. But if you see that they are such a young age of a person that offering them a total hip replacement is not a practical solution altogether. There comes the problem. The patient with COVID has led to the avascular necrosis. The hip joint is started deteriorating. So what to do now? And that's what we are going to address about this topic today.
Okay. All right. So the one treatment that we talked about, the conventional one, was the hip replacement. So what is the stem cell therapy on hip replacement? Or before that, what is stem cell? What is a stem cell therapy?
Okay. Stem cell is science of regeneration, where the dead and damaged cells are replaced and rejuvenated with a new cell using the mesenchymal cell. So as these new cells are getting formed, the cartilage and bone which is damaged is getting formed, and this particular cartilage repairing will alleviate the sign of the arthritis, and the problem of the avascular necrosis can be addressed using the stem cells.
Wow. I mean, it sounds so simple from your mouth, but actually it's a development of the medical science that we are able to do something like this. Thank you for introducing the stem cell, defining the stem cell. So how is it different than the conventional treatment?
Yeah, nowadays, if you see the medical science and orthopedic science, the orthopedic science is going towards more conservative approach. Bone reconstruction, replacing the huge part of the joint or bone, is something which is not nowadays preferred by the surgeon. But if we can repair and regenerate the damaged and dead part of the joint, is always better option. So better to preserve the natural joint is always a good option. And that's what the stem cell is doing about it, about the joint.
Okay, okay. So now how do you treat avascular necrosis with the help of stem cells?
Yeah. As we already clarified, the stem cells are pluripotent mesenchymal cells, which are having the great rebuilding and regenerating capacity. So this rebuilding and regenerative capacity of a stem cell is useful in forming the new bone and new cartilage, you can say. So that so when we inject the stem cell in the damaged part of the bone and cartilage, the new bone and new cartilage get formed, and which will be helpful in repairing or reversing the problem of the avascular necrosis.
So you mean to say the human biology by itself is able to take care of the disease with the help of new stem cells?
Yes, definitely. Your own body.
Okay. Wow, wow, wow. So, so this is about the AVN, and at the same time, we are also going to talk about the knee arthritis. So, can stem cell also address knee arthritis?
Yes, it is a very good question. If you know that osteoarthritis of the knee joint is a huge and widespread problem. If you see the person above 60 years, almost 60 to 70% of the persons shows the some sign of the osteoarthritis. So it is wear and tear of the joint, which will incapacitate the patient, and walking and standing and functional activity get affected in a great way in osteoarthritis of the in osteoarthritis patient, mainly affecting the knee joint.
Okay. Okay. All right. So you mean to say in this entire process of treating AVN or knee arthritis, you don't use any surgical methods at all.
Yeah. See, using the stem cell to recover the damaged cartilage is a painless, dissection-free, anesthesia-free procedure. It only involves the injection needle prick so that you can inject all the healing cell of the body inside the knee joint by the simple intramuscular, simple injection. It's the same injection and same pain you get during the intramuscular injection otherwise. So
wow, this is
all a big procedure or invasive procedure or painful procedure.
So this is so wonderful. I mean, you are saying that there is no surgery required, there is no anesthesia required, arthritis and your avascular necrosis totally.
Yes, yes.
Wow, wow. So the first question that comes to my mind is like, is there a hospitalization required for this surgery?
This is usually a day procedure.
Okay.
In the morning, patient gets admitted, and the evening patient can get discharged without any of the issue. As I told you, it's not operation, it's only needle prick which is getting involved. That's all.
Wonderful. So it's kind of just a day procedure where the patient comes to you in the morning and by the evening he is going back to his home. Okay. And after the therapy is done, the number of sessions are done, do patients have to come for any kind of follow-up visits or something?
Yeah, what we tell patient, every 3 weeks or every 4 weeks, and every 1 month, they just be in touch with us, and so that we can tell them and decide and instruct them on the physiotherapy and other precautions which should be taken so that to alleviate the pain and alleviate any of the discomfort or any of the difficulty what they are having can be addressed by us and immediately treated by us. But fortunately, these kind of difficulties after the injection usually do not come forward. We tell the patient to follow the regular follow-up, but it is not that essential because after the treatment period of injection, much of the care is not required after the stem cell therapy.
Okay.
And in case of any other problem, can with approaches, we can definitely solve the problem.
Wonderful. So what is the success area of this treatment?
Yeah. I will definitely tell you the success rate. The success rate of the osteoarthritis of knee joint is almost 94% success rate. Yani if we do the stem cell therapy of the knee joint, 94 out of 100, they get very much satisfying result and pain relief.
94%, that's a great number.
Almost 94%.
Wow.
And rate of 6%, if the things are beyond the damage, if the instability is very high, if the ligament damage is very, very high, then there can be some type of problem. But by and large, 94 to 95% patient get a substantial improvement after the injection.
Wonderful. So how do you define the success? Like how do we come to know that the procedure has gone successful?
Yeah, I just say the stem cell therapy for the osteoarthritis is one of the FDA approved treatment. If the FDA has already uh, authenticated and certified their treatment, that this treatment is very safe and very effective and very high success rate, you can say. The success criteria can be monitored in multiple, you can see points, that the relief of the pain, decrease in instability, decreasing clicking sound in the knee joint, improvement of the walking distance, and all these different small point indicate how much successful we are in osteoarthritis of the knee joint after stem cell injections, you can say.
Okay. And how soon can patients see these results?
Usually the patient result is seen within say 5 to 7 days to 8 weeks is the average time where the first sign of improvement appears. And as the days goes by, the improvement sign will go on increasing slowly and steadily. And yeah. And we have got another options by taking the multiple MRI of the knee joint again and checking how much the cartilage has repaired. I got a model of a knee joint of osteoarthritis, which will elaborate the status of osteoarthritis and our result. Let me show you the model of the knee joint.
Yes.
Yeah. This is the model of knee joint.
Okay.
You can see the greenish bluish area is a hyaline cartilage which is covering and protecting the articular cartilage bone. These green area or blue area are the articular cartilage. And if you see that if due to the wear and tear and aging, these cartilages undergo damage and degeneration, then the underlying bone is exposed, the subchondral bone gets exposed. You can say it is a reddish, rough, irregular surface. Which get found. And you can actually measure the size of the damage on the MRI. And we can again repeat the MRI after some periodical interval and check how much the cartilage has regrown and what is the status at present.
This is amazing.
So this is about the follow-up study of osteoarthritis knee joint after the stem cell therapy. I have my clear.
We can see the changes in the MRI after the treatment. Okay, and also, that's how we establish the success of the therapy. Wonderful. And after the stem cell treatment is done, how soon can somebody start with the daily routine?
In 48 hours of the admission, patient can resume his normal activity which he was doing before.
And like in the conventional therapies, like surgeries, for example, after the hip replacement or knee replacement is done, patients generally have to go for a series of physiotherapy sessions, and they have to spend a lot of money doing the physiotherapies as well.
The stem cell therapy has got a great advantage over the joint replacement in a way that after the joint replacement, the range of the movement is much restricted. Number two, this new joint cannot take up the normal stress and strain of the patient during the daily routine. So the patient has to be very, very careful for movement. They must avoid all the stress and strain the patient is having. And third thing is that many of the body movement will not be 100% after the total knee or total hip replacement. They will be restricted. Fortunately for the stem cell therapy, these limitations do not arise.
Okay. So,
Yeah,
I think, you have addressed one very important thing over here, and a lot of patients actually have the same problem. The implants that are used in your knee replacements or hip replacements cannot give you the flexibility
okay,
required in a routine life. You know, like the Indians, for example, all of us
absolutely.
are
Yeah,
used to sitting on the floor, for having meal or whatever. Like even in the casual time, a lot of people are used to sitting on the floor, doing the yoga and exercises and what and what not. But when the
yeah,
implants happen after the knee replacements and hip replacements, they cannot do that comfortably. In fact, that can cause a wear and tear as well, and infections as well. So
yes,
you have touched a very beautiful
yes,
part.
yes. You're
Yes,
perfectly, absolutely right. Pankaj, yeah,
right,
you're right.
right. Uh, and the follow-ups, I think let's take the questions now. I think let's take the user questions now. Okay, we have received some amount of questions. Mr. Sunil, if you want to ask any question, please type it in the chat box. I request you, please type it in the chat box. Whoever wants to ask any questions, please type it. In the meanwhile, the questions that we have received already, I'm going to ask it on the behalf of the patient. Okay, so the first question has come from Mr. Jayantilal. Mr. Jayantilal is asking, I am 63 years old, I am diabetic,
Mm-hmm.
and also have a heart
Mm-hmm.
condition, and recently diagnosed of the knee arthritis. So is stem cell therapy good for me?
Yeah, definitely. Thing is that total joint replacement are very, very risky and hazardous if the patient is old with a diabetes, with a heart problem, blood pressure problem, and other medical condition. So that total joint replacement is one thing which has to be avoided, and doctor will definitely tell you that these things are not possible. But on controversy, the stem cell are very, very simple, non-invasive, without any of the anesthesia or dissection or complications. So that the stem cell is very, very safe and effective in such kind of persons.
Nice, nice. Before I take the second question, let me announce we are going to have a very special guest joining us after this question and answer sessions are over. This guest is going to talk about, so this special
Yeah.
guest is going to talk about the commercials and the ways we can proceed taking this treatment after we are done with Dr. Bagul's question and answer session. So please stay tuned, please be here because we want you to be getting benefited out of this session. Okay? So my second question to you, Dr. Bagul, is from Mr. David Fleming from Canada. He is asking, I have an AVN condition in my hip and shoulders. Can this be treated at the same time?
Yes, definitely. Yeah, shoulder and hip joint are similar joint and it has got a similar compliance, similar conditions, and treatment also is very similar. So we can definitely tackle the both shoulder and hip joint, even bilateral at the same time without any of the issue.
Okay. In fact, my next question was about a bilateral thing. Like there is a person having bilateral hip condition, okay, having problem with both the hips. So can it be treated together? And you said yes, it can be treated together.
Yes, it can be
Okay.
treated.
Another question is there any side effect of this therapy? Is there any side effect of the stem cell therapy?
Fortunately, stem cell is one of the very safest therapy. There is no counteraction, there is no damaging effect of the stem cell anywhere in the body, anywhere in the joint and cartilage. There is no deteriorating effect.
Okay. All right. Another thing is anesthesia required during the bone marrow process? Then how stem cell is a painless procedure? Is stem cell a painless procedure? Is stem cell therapy a painless procedure? Do you need anesthesia at the time of the treatment?
As we already discussed, the stem cell is only needle-based injection procedure. So pain required during treatment, we receive during treatment is only the needle prick. Even if you give anesthesia, you will be getting a needle prick. Even if you would do the stem cell straight away, it involves only needle prick. So it's patient choice, but I think this particular procedure is very safe, non-invasive, and don't require any of the extra precaution, extra risk, whatever say.
Okay. Rochelle is asking a question. How do you access the stem cell from the bone marrow to be able to inject it into the area affected by AVN? How do you access the stem cell from the bone marrow to be able to inject it into the area affected by AVN?
I can hear. We can discuss.
Okay. So let me ask you the question again. How do you access the stem cell from the bone marrow to be able to inject it into the area affected by AVN?
Yeah. I just tell you, this particular procedure is widely displayed and available on the internet, on my website and also others' websites also. This particular procedure requires the needle prick in the bone marrow, taking out the sample of the bone marrow and then processing, separating the bone marrow. A part might be get cultivated if required, and rest of the mesenchymal cell, pluripotent cell, will be re-injected back.
Dr. Bagul, can you hear me now?
Yeah, I can hear you.
Okay.
Okay,
So,
yeah.
Dr. Michelle Warren, we have Michelle Warren
Okay.
from
Hello, Michelle.
Jamaica, and she's asking, my main concern is sickle cell disease and AVN hip and shoulders. Her one leg is already shorter. Can stem cell correct condition?
The stem cell plays a very great role in preventing the clotting of clotting within the intravascular portion of the medium-sized vessels, so that the AVN, which is progressing very fast, will be halted. This fact is known to everyone about the avascular necrosis and the sickle cell disease, definitely. The one more very interesting part or development which is coming up nowadays is that we can actually use the gene cell-based stem cell therapy to correct the problem of sickle cell right from the base. This no one has discovered up till now, but stem cell is now slowly proving that even the sickle cell genetic disease can be restored and recovered. Yeah, please go ahead if any question.
Another question from the same patient is, what type of stem cell do you administer? Since the protocol is 1 day, how many cells will be?
Yeah, there is a fixed formula. Yeah, it's a very good question. These particular number of cells used during every session depend on many of the factors. Depending on the age of the patient, severity of the disease, status of today's condition, and many other factors determine the number of stem cells to be used in the patients.
Okay, all right.
So there is the hard and fast rule is not there.
Okay. One of the last question is from Mr. Sunil Singh. He is saying pain has reduced and I do not have trouble in walking, but cannot run or jump. Can stem cell help to repair damaged cartilages?
Yeah, definitely. See, thing is that after the avascular necrosis, there is some amount of repair attempt goes by the body, which will lead to the incomplete improvement in the movement, you can say, but it will always incomplete. With the help of stem cell, the movement will be much better, and all the functional activities shows lot of improvement after the stem.
Okay. And can it make my knee flexible? I think Mr. Sunil Singh doctor has already answered that question, that it will be flexible. Okay, he is from Sunil Singh again, but I think it representing a lot of questions. Will osteoarthritis or AVN come back again after taking the stem cell therapy? After taking the stem cell therapy, will osteoarthritis come back again? Hello?
Can I ask question for myself?
Attempt.
Yeah, Sunil, ask your question, please.
Yes. Can I ask directly? So, Dr. Bagul,
Yes.
questions are: number one, what is a guarantee of the treatment? Meaning, if I start a stem cell therapy, how many time I will have to go through injections, and what is a guarantee that I will be cured 100%?
See, one thing is there.
Yes.
That after the stem cell, the new cartilage will get formed, and the movement and functioning of the joint will show a lot of improvement. But the age factor is there. Is going to come up once again after after 3 years, 4 years, 5 years, 6 years down the line. This age factor and regeneration will again come over. At that time, the complaint and difficulty might get reappeared. So you can say 8 to 10 years, you can say, assurance.
Okay, now my question was not that. Let me try to rephrase it. If I start a stem cell therapy, so I have to get all injections one time, or I have to have multiple injections with a spaced out period of time? And what is the guarantee that my current problem will be resolved 100%?
See, we give all the stem cell related injections over the 5 to 6 days time.
Okay.
Spread over the 5 to 6 days, spread over. Daily we'll be giving you some injections, HBOT and other words of the treatment. Okay. Recovery initially is almost more than say 93 to 94% recovery will be there. And as the time will go by, the recovery will go on increasing slowly and steadily. We can say take it almost 10% guarantee that after the stem cell, there will be substantial relief of your symptoms and signs.
My question is very clear. Will my flexibility of the knee will come back or not? Because pain has already gone. I do not have pain. I can walk.
Why there is a restriction on the movement? Why there is a restriction on the movement?
Since last 10 years, I cannot bend my knee.
The presence of the damaged articular surface, which will lead to the muscle spasm, and the activity will be restricted. Once the cartilage healing appears, the pain goes down, the muscle fiber spasm will go down. They definitely the improvement in the activities and range of movement will be seen. I hope it pinpoints to your question.
Yes, it does. It pretty much does. And I think we have answered all the questions that were asked by the people. And Dr. Bagul, now, is there anything that you want to add on your own? Is there anything that you feel that we have not covered?
Okay. So you can say one thing, that this is a therapy akin to the nature. We are repairing the natural joint and restoring back the natural environment and natural joint to the particular individual, so that all the hazards and the complication and difficulty of the joint replacement can be avoided totally. So this is a new weapon in your hand. It is said in Marathi we say, तुझं आहे तुझं पाशी मगर जागा चुकलाशी. Means you have got your own healing power within your body. But if you use proper healing and regeneration of a damaged cell from your own bone marrow, that will be much more effective. So you have got your own healing power. Only thing is that you have to use your own healing power properly for your own recovery.
That's one of the best ending phrase statement that I can say that we have heard of. Thank you, Dr. Bagul, for this insightful session, and thanks a lot for answering all the questions very, very patiently. And I'm very sure this is going to help our patients a lot. Okay, thanks a lot for being there. Now we are going to the last phase of this webinar. I'm going to call the commercial head of medical experts, Mr. Dheeraj Sharma, to take it on from here, because he is going to discuss the commercial aspects of taking the stem cell therapy and stem cell treatments. But before we start with that, Dr. Bagul, though I know you are extremely busy with your OPDs. I request you, if at all you want to stay back, you can, but otherwise you can exclude yourself. And we can start with the further session.
Commercial aspect. Okay, is there any of the technical issues? I will stay on the board, or you people can continue with the technical.
There is no technicalities now we will be discussing. We will not be discussing any technicalities right now. We will be discussing just the commercial aspects of it. And if at all there is any question, we will get back to you on a personal level.
Yeah, perfectly all right.
Okay. Thank you, Dr. Bagul, for being there. Thank you.
Okay. Yeah.
Namaste to you.
It's nice talking to you. It's nice talking to you people.
Thank you, sir. Thank you.
Okay.
Mr. Dheeraj Sharma, the most awaited guest, and I'm very sorry to keep you waiting, Mr. Dheeraj Sharma. Mr. Dheeraj Sharma is a commercial head of medical experts, and at a very special request of me, he is over here, because I feel just knowing about the treatment is not enough. You should also know the commercial aspects of it. You should also know how are you going to embark on this journey of taking this treatment. So let's welcome Mr. Dheeraj Sharma, and over to you, Mr. Dheeraj Sharma.
Good afternoon, everybody. Am I audible?
Yes, sir, you are audible.
Am I visible?
Yes, very much. As handsome as ever.
So, good afternoon, good evening, ladies and gentlemen. So, Pankaj has given me a responsibility that I should be doing something special for the webinar attendees. He was looking for, and he conventionally looked for, that something special has to be done to all those people who are contributing with their time and energies to spread the word about all the new technologies which are coming up in this space in the healthcare sector, and how we can spread the word, how we can educate the people more and more within authentic. So this is one of the very integrated part of medical experts. So I will try to do justice to that today. So can I share my screen?
Yes, sir. You are allowed to share your screen. Yes.
Is my screen visible?
Yes, on a presentation mode, it's visible.
Great. So guys, first thing, what is the way forward? I hope all of your clinical and technical questions are answered by now. And I would also like to emphasize that, and knowledge awareness is one part of thing which is very, very important. And I must advise you, more than a commercial, you should be more focused on a clinical outcomes. And stem cell therapy, the way the world talks about it, is going to be a new way of treatment. It's already in advanced stages of it. Stem cell therapies is something, if you has reached, is 20 to 30 years old as a technology and reached to a different stages. For hematopoietic stem cells, which is typically used for a cancer, it's a very well established procedure. Now, recently, there are certain products of the mesenchymal stem cells which are also approved, which is in another league of authority by the governments onto the stem cell procedures for ortho-related diseases, which might be the today's subject, or AVN or joints and all such kind of a thing. So one thing is the awareness that there is something new which is available, by which you can avoid the surgical pains, recovery periods. You can retain the movements of a joints. With this awareness, the next thing is action. And how you can take the action is what I'm going to share as in next steps. After this session, all the discussions we had, I was seeing that there is a gentleman who was keen to have a detailed session. So this is precisely what is recommended. You should first, before taking a call, whether it's right for you, my recommendation is get thoroughly satisfied, understand it very well with one-to-one consultation, personalized one-to-one consultation with Dr. Baugul, and try to understand with your particular case what kind of outcomes you can get, what could be the challenges you can get, what would be the stay, and also the dosages. There are cases where the dosages are more dosages are required, and there are few cases where one cycle is sufficient. There are few cases where 2 cycles are sufficient, and all such kind of a thing. So that's going to be discussed in one-to-one consultation. And that personalized one-to-one consultation is going to be focused on your reports, your disease. So first recommendation, first get yourself thoroughly convinced that it's absolutely right for you. Understand it in very, very, very much detail, that what is that you are going to achieve by going through this stem cell therapy, and that's going to happen in one-to-one consultation. Thereafter, get procedures done and enjoy your life happily. So since the agenda is of this particular session, and I am expected particularly to announce some discounts, some special things for you guys who are really serious to move ahead. So if you are the guys who are looking for that, some kind of a special webinar discount and rates, I guess you should continue to see my another 10-15 minutes. And those who are not looking for a special rates and a webinar discounts may like to leave the webinar and continue your day-to-day exercise. So here onwards, I'm going to talk about something as an special rates. So guys, I have been given a responsibility that something special has to be done for our webinar attendees. And let me share very frankly, that I really don't have any magic wand. There are some cost involved, which definitely has to be recovered to give a sound and decent result and a decent experience. But still, there was a responsibility. I tried to do something and tried to devise some mechanism whereby not all, but few of you would definitely be able to get some discounts. So let me share, and before we talk about the discounts, we need to understand that what are the regular prices. So the regular prices, there are the discussion have happened. There are certain stem cell products which are government approved, FDA approved. Those are definitely a costlier one, and the cost typically goes with the per dosage. So the major component here is definitely one of the major component is the stem cell itself and the sourcing of the stem cells. So there are two ways. There are standard products, and this is typically very important if you guys are planning to have insurance claim. If you are going with a government approved, FDA approved products, you would be able to claim the insurance, and the team, medical experts team would guide you what are the steps, how you can get the pre-approvals and things like that for along the whole process. So those who are seriously looking for or having a insurance, my recommendation is only go for government approved stem cells products so that you can get your claims reimbursed by the insurance companies. Those who are planning to go or with their own pockets, they can definitely go with the regular procedure where your stem cells are going to be taken, refined, defined further in the labs and re-injected. So if somebody is going for government approved stem cell products, the typical cost is regular cost is 2,50,000 rupees in INR for a dosage, which is for the audiences which are from outside India, it translates into somewhere USD 3,125. For the regular stem cell products, for it boils down to 1,75,000 per cycle or per dosage, and for India, for US guys or outside India guys, it translates by and large into $2,000. Additionally, there is going to be certain investigations. Investigations are just to ensure that, and that typically goes in Indian rupees 10,000 to 15,000 rupees. And for the outside audiences, it translates into $150 to $200 approximately. And this particular the cost is also covered for the stem cells, for the surgeon fees, and the stay in the hospital along with one attendant is also covered when I'm sharing these rates to you. So now there is something called webinar offer. How many of you are seriously interested to know the offer? Can I have some guesses? Who is interested? Pankaj, I'm not able to see the messages here. Can you help me to say that?
I'm able to see some messages. I see some hands up. So there are people interested in knowing. There are more than 8 people who have sent me messages, and I see some hands up as well.
Okay, great.
People are interested to know more, Mr. Dheeraj Sharma.
You always give me a challenging task. So friends, as I mentioned that there is no magic wand, but finance, there are tools available with which I'm able to do something. I'm going to share with that, and that's the precise reason. Let me see what is the level of discounts are going to make you happy. So what if I do something like 7.5% discount? Guys, give me a feedback.
Sir, if we can do some more.
Pankaj, you are
More.
I'm representing my patient, sir.
I respect that. I really understand, appreciate, and respect that. What if I make it 15%?
That's huge. I was not expecting that much. I thought you would stop at 10%.
But I'm still saying that may not be able to do for everybody. So yes, is there anybody who is also looking for a bit more? Shout it out.
More.
Yes.
Natalie is saying more.
Rochelle. So I will remember that name, Rochelle. You have
We are expecting 30% plus.
Sunil Singh is saying
Sunil
30%
Singh ji, Sunil Singh ji, I would definitely try my best. So the next is those Sunil Singh ji and Rochelle. Let me make it 20%. Sunil Singh ji, 30% might not be that feasible. I will discuss it with you a bit later. Otherwise, I need to do something more. This is what I come
इसका
with.
दो reason है. One is that I have to travel all the way, so my flight cost is added on my expenses. And second is that the insurance that I have needs me to pull in 20% of the total cost.
Okay.
20% of the discount, you can get it, right? I can ensure that you are getting it. So it's almost going to make you something like that.
And what is the difference in potency between government approved and regular one, or effectiveness?
Sunil Singh ji, I will
Sunil
take that
Singh ji,
session.
I would highly recommend, once you are having a very detailed discussion with Dr. Bagul, you can precisely ask this question. I can share my general understanding. There is not a much regular difference into the potency, but for a insurance claim, you need to have a certified products. And for any organization or a pharma company, there is a big journey which they take, right? To get that authorized. They work for almost a decade with clinical trials and all such kind of things. And they try to recover that. And they are very fair doing that. So regular or government approved products are typically costly. But still I would prefer to avoid the questions where I'm not very master of. So I would highly recommend to have a discussion with Dr. Bagul, understanding the differences, and he would be a better person to answer that. Right? So let me also share with you why I am saying I would not be able to do for everybody. See, I have a responsibility here both ways. One way, I seriously respect all the audiences who have taken their time contributing to the initiative of spreading the healthcare education up to the last miles to the beneficiaries. But at the same time, I do also have a responsibility that everybody should be in a win situation. It should not happen that the things are not becoming viable or somebody needs to compromise. Either the doctors, hospitals, anybody should not be able to compromise. Still, there are few set of people. If I need to pass on certain benefits, how to do it is my challenge. And the second is there should not be any compromise on the clinical outcomes and returns. That is also my responsibility and limitation whereby I need to work. So what I devised is a mechanism is somebody's gain is going to be somebody's. See, money can't be produced, right? Like energy we talk about, it can't be stored, it can only be transferred. So yes, in my capacity, I can definitely do that. One thing I could have done is a standard discount for all. But if I need to respect the wishes of the people who have taken the time to attend this webinar, so what I devised is a slab-based mechanism, whereby first slab, the 3 patients are going to get the 20% discount.
Okay.
The another 3 patients are going to get 15% discount.
Okay.
And another 3 patients are going to get 7.5% discount, and rest are going to be at prevailing prices. This is my mechanism to ensure that genuinely, seriously interested guys, or those guys who are seriously not able to afford it, get a right opportunity or become a winner, a better winner in this situation. I always recommend to the people, those who are able to afford, leave it to the more needy persons. But that's my mechanism to ensure that we are able to create a win-win situation. It was simple for me in a very uniform way, create some 5%, 7% for the whole lot of other things. But if I need to respect, then this is my mechanism. I will give from something, make from somewhere else. Once win is going to be definitely, there are definitely going to be few who are not going to get even anything. So that's my way, because this is the only thing which I can do within the set of limitations which I am having from the organization's perspective. And I also need to respect the audiences here. Pankaj, from last 7 days, is behind my life. What is that you can do? What is it? It's your problem how you do it. But I want something from the audiences to be done. So guys, this is the mechanism. So slab wise, now another question is how you essentially going to ensure that, Pankaj, that how we are passing. It should not, medical expert is known for a transparency, be it the clinical one or be it in a financial one, right? The transparency has to be ensured. So there is a mechanism even for that. Before that, what I can do, the request which was made in the last gentleman, more than financial, what is that I can also do, which is in my capacity, using a different kind of a budgets, not this kind of a budgets. For this particular session, I have thought something more in a services part, if I can do it, because here my limitation are I was having some other budgets where I could have done something. So what I have done is, typically there is a no food for attendants when they get admitted in a hospital. So this is another thing on a services part, which is definitely in my hand. I would not shy away to give it to and this I can give it to all. Forget about is, because that's a different kind of a budgets, hospitality and patient care budgets. So I do have a liberty there. So I extend that. There is one more thing which I can do. Let me not play the games here. So I would also ensure that in a hospitality budgets, which is operational budgets, pick and drop from the nearest airport is also I'm going to ensure it's arranged. Right? So the discounts on our packages, Pankaj, and few things in our services. And this is precisely the maximum I can do it. The slabs which are there must have to be respected very well. Please don't come and say make 3 to 4, 4 to 3 and anything else. I'm sorry, I would not be able to do it. So how to avail these benefits? So obviously these discounts are going to be applicable for action takers and serious guys, and which is the purpose to know and to first get educated further with respect to the outcomes, modalities, insurance product, regular products. You need to have one-to-one consultation. And before you take a call, as a medical experts, it's the obligation that you should be informed very thoroughly, everything about it, about your case. So you need to definitely go for one-to-one consultation. And for one-to-one consultation is definitely a prerequisite to move forward to ascertain the right, I would say, whether one cycle is required, two cycles is required, one knee is required, two knee, whatever is required to ascertain that what could be the cost. And guys, please, I want to assure you, this is not the focus. This is not the business. Definitely, but this is definitely a mechanism whereby the slab allocation can happen. So consultation will be organized as per the sequence of the way the payments are collected. And that's a very nominal. Those who are from India can understand that a surgeon with 31 years of experience and 2,500 rupees is absolutely nominal in category. Post consultation, get your procedures done within a month. Right? You are most welcome once you are able to get the consultation, a precise treatment plan, including your stay, duration, number of cycles, expected outcomes. Once everything is clarified, you are expected to get your procedures done within a month. Because of some reason or very genuine reason, my recommendation is get the procedure done. You don't need to see beyond my slide. But for those who are having some visa issues or some very genuine needs and commitments or something like that, and not able to do within a month, then also you can hold this, your slab, by actually committing, not only on the words, but by substantiating that commitment in terms of some advances of the order of 25%. You need to make an advance. Slabs would be applicable on the first come first serve basis because we need to ensure the transparency. Consultation charges, I already mentioned, is not a part or not an is not what we seriously would like to collect from you guys. So these consultation charges would be adjusted with the procedure cost. Consultation charges is a mechanism to create a transparent mechanism whereby the people can be allocated the right slabs. Am I clear so far? Sure.
Yes,
Okay,
sir.
let me also share, rather than people try to put their mind how I can be can take the maximum benefit in this particular framework. So let me answer that. Early action takers are definitely going to be benefited. Those who would book the consultation fast and can come in the first 3 are going to get a maximum slabs. Who would book the procedure fast and will come in first 3, because consultation is sequencing mechanism, and thereafter after the consultation, if it turn out and doctors say that you may not be so benefited, please don't join, etc. So first 3 procedures are going to get the benefit, right? So these are the guys who are going to do it. So the summary, what I could have done here is first slab for 3 patients, 20%, second slab, 15% again for 3 patients, third slab, 7.5% for 3 patients. Along with that, regular vegetarian food for attendant, which is, we may not be able to entertain the special request of the food, because there are some regulations, hospital regulations, there are dietary compliances and all such kind of a thing. So whatever the regular food is going to be available for the attendant also. One pickup and drop from the nearest airport is also we are going to arrange, right? Consultation charges would be waived off or adjusted into the procedure cost. Let me use the right terminology, adjusted within the procedure cost. Pankaj, can you ask the team to share the links so those who want to actually book the consultation and want to be ahead in the race? Or
It's shared.
It's shared. So this is the last slide, guys. You can take the actions now onwards. If there is any questions with respect to this one, I'm happy to take.
Yes. The links are shared with you, and this is the best opportunity for people to take it forward from here to get the maximum discounts.
So if there is no question, Pankaj, I would prefer to take the lead. So if there
yes, I see no questions, sir. And thanks a lot for coming on my request and making this thing possible. I seriously respect the discounts that you have offered, and you have gone out of your way to do that. Thanks a lot, sir.
Thank you.
Thank you. And here I thank the audience as well for being there, Mr. Sunil Singh, Rochelle, and all other people for patiently being around and being a part of this interactive session. We are going to be in touch with you immediately after this webinar to take your requests for consultation. You are the one who has to act immediately. So the links are already given. Please act on it immediately. Make your payment so that we can connect you to Dr. Bagul and you avail the discounts as well. Great. So thank you all once again. And on behalf of the whole Medico Experts team and Dr. Anand Bagul, I thank you all. Namaste to you all. Thank you. Bye-bye.